Dr. Allison Edmonds with Freedom Health Center, and I'm so excited to introduce this gentleman to you today. We have Dr. Dan Cobb with us, and he has Alex Bell Dental here in Dayton, Ohio. And I'm really so excited because this man is not only a wealth of information, but he is a practitioner that doesn't just settle with what he was trained in dental school. I mean, we know that the way that we practice is all of the additional hours, all the additional information that we seek out, that is truly what sets us apart as a practitioner. And so we're going to dive into some really exciting things. We're going to talk about the mouth-body connection. We're going to talk about heavy metals and their impact on your overall health. But first, I would love to just get started. Dr. Cobb, will you tell us just a little bit about yourself?
Hi, Allison. Thank you. I'm a general dentist, and I've been practicing for, I think, 44 years now, and plan on practicing a little bit longer because I'm feeling pretty good still. And as I progress in doing dentistry, I always like challenges. And what I like doing in dentistry is figuring out, okay, what are problems causing people, and how can we help them get better? And we're finding as we get older and older that dentistry has a lot to do with our overall health.
So the mouth-body connection, that is something that more people are they're just becoming more aware of. I feel like that in the quotes is something that people are repeating, but can you tell us more about the mouth-body connection?
If you think about it, in the anatomy, the mouth is located right here. You've got the mouth and the nose, and that's a major orifice for breathing in and for bacteria to come in, and it's the beginning of your digestive system. And so from that, we can tell a lot about what your health is by looking in your mouth. And what we're finding out is the connections now between your mouth and your general health in the area of diabetes, in the area of strokes, in the area of heart disease. And so we look at these connections, and we want to make this place nice and healthy because we know that we can reduce the chronic illnesses that we can get if we don't have the mouth healthy.
So this is totally a rookie question, but does that mean that you could look into someone's mouth and with your experience then either see that they may be progressing towards a certain disease, or they potentially have already been diagnosed with that?
So if we start looking in the mouth, for example, and if we check their gum tissue and we find that there is bleeding of their gum tissue, which is one of the signs of periodontal disease, we know that that bacteria is swimming in the mouth, but it can also get into the circulatory system, and it can swim to other places like the heart, like the coronary arteries, up into the brain. And those bacteria and virus can attack those areas and with inflammation, can cause a lot of damage in those areas. And inflammation is a lot of it. And we're finding that now that if we've got inflammation in the mouth, then we've got inflammation in the body. If we have inflammation in the body, then that increases our risk for all of these illnesses.
Yes. And one of the things we teach is that hidden infections, and I think that's exactly what you were talking about, these tricky little boogers that will find themselves in all kinds of places in our body. Hidden infections are one of the top 3 things that are causing most diseases. So why do you think that the mouth-body connection, this gets overlooked so often?
Well, it gets overlooked because I think that dentistry hasn't been necessarily part of mainstream allopathic medicine. It's sort of a cottage industry compared to working on your gut or working on your foot or working on your skin and things like this. And so we don't run around necessarily with the physicians, and we aren't part of the MD skill sets. We're dentists, and so we just run our own way, and that's sort of how it's been from dental school on. I think we're getting closer to where we understand how we need physicians to help treat a patient to healthfulness, and I think that physicians are starting to understand that the having a healthy mouth is going to have healthy people. And so it's starting to bleed over, which is a good thing. And it just needs to happen more. But because of our silos, it's been an issue in the past.
Gotcha. Well, I don't know about how dentists feel about this, but chiropractors, we love to kind of align with dentists in the way that we think about, taking care of the spine and the health, because like you said, it's not generalized that we are, we're not internal medicine specialists, we're not gut specialists, like things like that. But when we do take care of the spine, knowing that it directly affects our nervous system, it therein affects the entire body. And so it's just really cool to see how you as a dentist, like you said, you're not just in there to just fix a tooth, you're looking at the whole body connection. And at some point, I know we could talk for hours. We're going to dive into a lot of different things that you've incorporated to your practice, really to help people find overall health and support them in multiple ways, which is so excited. I have to say just about your office. And I tell everyone this, I'm so proud of you guys. I'm proud to be able to refer patients to you. I send my whole family. Amalgam removals is something we're going to talk about in detail. But, the cool thing is my dad had no idea that I really wanted to detox him and get these amalgams out. All I had to do was send him to you, and y'all just took care of it. It was just beautiful.
Yeah.
But you have such a great team also that just helps people feel so welcome and really loved, honestly. So what made you seek out the proper way to remove amalgam fillings?
Good question. And I started attending some meetings when people were talking about amalgam and how mercury, which is 50% of an amalgam filling, is very toxic. In fact, in the periodic table, it's the most toxic non-radio, what's the word for it? Non-radiation emitting molecule in the periodic table. And so that's pretty bad. And the half-life is in the, hundreds of years for something like this. And so we have to say, okay, why are we breathing this in when we put it in the mouth? Why are we putting in the mouth all of this kind of stuff? And it made sense to me. It just made total sense that we shouldn't be placing 50% of what an amalgam is, that's mercury, into the mouth and having people, every time they chew, the mercury vapor comes to the top and you breathe it in, or it gets into your cheeks and causes the damage. And some people have a good detoxing ability in their body, and some people don't. And so a lot of these dentists that didn't have a good detox pathway in their body, they were getting ill, they weren't able to work, they were dying, they had chronic issues that allowed them not to work. And then they found out that they were toxic in heavy metals, of which mercury is the major one for this. And so they said, okay, if I'm going to stay in dentistry, I've got to be doing it to protect myself. Well, I have a bunch of dental assistants that are young and want to have families and everything like this. And, I want to live to be a ripe old age. And so, how can I best take care of them? How can I best take care of myself? How can I best take care of my patients? And so it just made total sense for me to say, okay, we aren't doing any amalgam in our practice, number one, which I haven't been doing for probably 25 years, but it's only probably been 10 years that I've been removing it in a certain way to protect everybody involved. And so that's why I got into it, is that I wanted the protection and I want to be as healthy as the next person.
That is awesome. So can you give us a brief description of the protocols that you have to take in order to safely remove these?
Yeah, for the dental aspect of it, there are a couple things. One is detoxing, of which the dental community is not allowed to, by the state dental board here in Ohio anyway, to prescribe detoxing regimen. And so I refer that off to Dr. Allison and let her take care of that kind of stuff. But when we see the patient, what we do is We as a practitioner wear protective breathing apparatuses more than the N95 mask. They're masks designed specifically to eliminate mercury vapor. And then we have the patient rinse out with some charcoal, and then we use a rubber dam to isolate the tooth so that we can not have to worry about it getting in the breathing of the patient and not getting into the cheek, into the mucous membranes. We have the patient breathe oxygen. We could have them breathe air, but oxygen is easier for us, so we just have them breathe oxygen. And then I have a special HEPA filter that I put really close to get rid of the extra vapors that might escape into the room. And then I also have a machine in my ceiling called an iontophoresis unit, which will take these mercury vapors along with bacteria and virus and dust and everything like this, and it puts a charge on it. And then that puts a negative charge on it, and then there's a receptor that collects it that has a positive charge on it. So it's like having a clean room in there, and it helps eliminate that mercury vapor from sticking around a long period of time. And so those are the things that we're using to help keep the person clean and everything like this.
That's awesome. Like, and it's quite a production to just have all those things working together. And well, it just makes you feel warm and fuzzy to know that that's important to you to protect your people. And that's really neat. My journey with learning about heavy metals and toxicity started before I went to chiropractic school, actually. And I had 4 large fillings put in, and I got so sick. My throat hurt. I lost my voice. I used to sing. I lost my voice for a year. I went probably 3 different times to get like a strep test, and it just kept coming back negative, negative. I'm like, you don't understand. Like my throat is so swollen. And it wasn't until I got those removed, and within 2 weeks, I got my voice back. Within 2 more weeks of 2 more fillings coming out, the pain started subsiding, the inflammation started going down. So can you talk just a little bit about, I don't know why that happens. Like, is it when you eat or drink, or what is happening as you have these silver fillings in your mouth?
Well, with these fillings, they're basically 49% silver, 50% mercury, and maybe a little bit of copper or something like this, or zinc. You can have people who have sensitivities to the metals themselves, and then you can have people who have issues with the mercury vapor coming off and causing issues. And it's not uncommon to hear things such as this. I've had patients that have had like a psoriatic redness on their tissue next to where the filling was, but on the cheek side, on the outside versus on the inside. And we remove the mercury filling and clean all that up. And 2 days later, that's gone.
Cool.
That's to say that happens all the time. And that's not to say that that's the genesis of psoriasis, but we've seen things like this happen. And as you're saying, you have this chronic sore throat, and sometimes that can clean up and everything like this. With a lot of people, they don't feel any different. And several people feel systemically like they are more healthy, like they sleep better, things such as this. And so everybody has a different ability to detox the mercury vapors and the mercury in the body, or the heavy metals. And so some people don't have an issue. Like, I was tested along with about 12 other dentists one time, and there were 3 of us out of the 12 that our mercury levels were very, very low, especially for the amount of time that we've been practicing dentistry and, had contact with us. And then there are other dentists that it was off the chart. And so that goes back to our ability to be able to detox.
I'd love to tap into that for just a second, because as we teach our patients to detox properly, we always talk about how inflammation starts at a cellular level. And the
Hmm.
only way that we can get the toxins out of the cells is to first open up the pathways, our gut, our liver, our kidneys, our lymph, right? These are so important. So you tapped into this a couple times, and I think it's important for everybody listening to understand, if your pathways are open, everything that you encounter is going to be able to flow, because our bodies were made to eliminate toxins and
Right.
bacteria and viruses, things like that. So I just wanted to tap into that. And then the detox that we offer, of course, is opening up those pathways, then diving into a cellular level. And then we have some really amazing products that can now cross the blood-brain barrier, the gut barrier, and they can safely bind to these toxins. One of them is the cytodetox. So really exciting how in the past, most of the zeolites, the clinoptilolite fragments that we've used for detoxification, they have also deposited heavy metals. But this is, I mean, one of the most minimal, it really is true amazing. And then we talked about, like you said, somebody's redness or just cleared up. And it's not to say that the heavy metals cause that, or like the heavy metal, like if you're struggling with any of these, like if you think metals could be a component of whatever your health condition, if you look up mercury toxicity symptoms, I mean, it spans a portion of the whole body, right? I mean, there can be mental things, anywhere from brain fog to more
Brain fog.
challenging mental things, digestive issues, depression. I mean, the list goes on and on. But the point of the story is, if you think that you have mercury toxicity, we know that the mercury, that's a physical, or excuse me, a chemical component. And then we have physical, and then we have emotional. And when these things collide, we know that's where disease pops up. So for example, well, I'll kind of dive into that here in just a few minutes. So basically the perfect storm. And we know if we're really going to find true health, we have to address the chemical, the physical, and the emotional components. So could you, like, if someone thinks that they have this mercury toxicity, like how would they go about getting started with you, or finding a dentist that knows these practices?
Well, we can test for it. That's one thing. I use something called a try-test, where we take a hair sample, we take a urine sample, and we take a blood sample. And from that, the laboratory can determine, is this coming from eating fish that might have mercury, or is this coming from breathing in mercury, or elemental mercury from the mercury fillings that you might have. And that tells you how well you're able to detoxify. And so that's a good place to start if you have major questions about that. And that gives us a good idea. Mercury fillings by themselves, they're sort of going the way of the dodo bird, because they are ugly looking. And, the mercury fillings were sort of came into vogue about 150 years ago. And we've got a whole lot better ways of taking care of cavities versus using dental amalgam. And dental amalgam does not last forever. It also causes other problems in the body that it's not good to have. And so, there's no problem in taking out old mercury fillings for whatever reason.
So I have encountered patients that, like, we're going through a detox and they go back to their I want to say home dentist, their dentist that they've had for
Mhm.
years, and then they ask them about the removal, and they say, oh, those are, at least 20 to 25 years old, those are safe. What would you have to say about that?
Well, there's probably less mercury in them than there was 25 years ago, for sure, because an amalgamation is not a making a new substance. It's really putting two things together that in this case hardens enough that you can chew on it and everything like this, but you can still suck out the elemental mercury, and you can still have the silver there. And so the mercury vapor will, every time you chew, every time you drink something hot, it will come to the top and it will vaporize. And over time, that will get less and less and less. And that's where you start seeing the chipping at the margins where the filling is to where the tooth is located. You start seeing cracking and chipping and everything like this. And,
Chipping of the
those are
filling or chipping of the tooth?
chipping of the filling.
That sounds pretty dangerous too.
Yeah, yeah.
Okay, so it's not necessarily like if they're older, they're okay. That's no, we don't like that.
No, we don't like older.
Okay, let's see. Tell me about the IAOMT for just a second, please.
IAOMT is an organization developed for dentists that look at toxicology issues in dentistry, and it's the International Academy of Oral Medicine and Toxicology. And so a group of dentists were like-minded, and so they developed this organization. And besides dentists involved, there are physicians, there are chiropractors. You don't have to be a dentist to be part of this organization, but probably dentists are the majority of it. And what we're looking to do is to share this education with younger dentists or with dentists that have, say, hey, I want to learn more, I want to know more and everything like this. And so there's a huge scientific component to this because it's all about the science. And so when we start saying that the mercury can come out of an amalgam filling, we can prove it. If we say that fluoride is harmful to the brain, we can prove it. And we can look at these things and we can scientifically say, yes, these are issues. And so that's where anybody can go to at the IAOMT.org website, and there's an area for lay people to go in there and do research and learn and ask questions and everything like this, and a good resource for anybody looking for this kind of information.
Great. So would it be an appropriate question if someone was seeking to get their amalgams removed properly to ask their dentist if they were SMART certified? Is that
good? Because that's sort of a certification that IAOMT has come out with, that you don't have to be an IAOMT dentist, but if you do the process in a certain way, which is what IAOMT recognizes is healthy for us all, that you can be certified and be able to market that.
That's awesome. That's awesome. So one thing I wanted to touch on was some heavy metal testing, and I think it's really neat. What did you call the triad? There was three. What did you call your testing?
Oh, I don't know. I forgot.
I forget. Okay, well, you had those three tests, and
it's a heavy metal tri-test.
Okay.
And it's called the tri-test because of the blood, the urine, and the hair.
Gotcha.
And they also test for other things besides mercury. They test for cadmium. They test for aluminum. They test for lead. There's probably 10 things that they test for.
Okay. So one of the tests that we do in our office is a heavy metal urine challenge. And whereas I know yours were looking at where is the mercury mostly coming? This is a deep test to see the toxic burden on the person's body. And so we're actually pulling quite a bit of mercury. So that's another option for people if they're wanting to get started in just removing metals. So we talked about the hidden infections, and then heavy metals, and then mold. We talk about these three as Dr. Pomp always refers to them as the three evil amigos. They're always the ones that are hiding in the background. And we know that addressing these three, it really does help people recover their full health. So I want to finish up with just a little bit on fluoride, if it's okay.
Sure.
Just because one of the reasons that I initially contacted you guys and just started, sending all my patients, I just tell them, hey, I'm doing the detox with Dr. Allison. You just call over there and they know what to do. It's amazing. But one of the reasons that I feel so comfortable, I don't have to ask you questions and worry about, is this toxic? You're looking at all those things. And I know fluoride that's a hot topic. Tell us just a little bit more of some of the dangers and then why you chose not to have it in your practice.
Yeah, fluoride is a known neurotoxin. Um, and the fluoride that we get in most of our toothpaste and dentistry is famous for, giving more fluoride. Fluoride is not a natural molecule in the body. It's not needed for any biochemical reaction. But the fluoride in our water, for example, comes as a waste product from fertilizer companies. And they didn't know what to do with all of this, and they couldn't dump it down the drain because they would get, taken to the cleaners by the government because it's very toxic. So they figured out early on, hey, let's see if we can't market it and say, hey, this is good for reducing cavities in teeth, and let's market this and let's sell this. And so now we can sell our waste products to theoretically make teeth stronger and harder.
I remember little tiny purple pills when I was little. Like our pediatrician said, "Hey, give them these," and we got 4, and they tasted like grape. Like they were poisoning us, basically.
Yeah.
That's amazing.
Yeah. So there's been a lot of research done. University of Toronto has done a lot of research done in Mexico with mothers, and have followed them for, I think it's been now over 20 years, and followed their kids and everything like this. And they noticed that there is a difference in cognitive abilities, and it's less cognitive ability with the less brain thinking, the more fluoride that you're exposed to. So if you have a lot of fluoride, you're going to have more cognitive disabilities than if you have less fluoride. And they've shown that time and time. In China, there was a study done the same thing. And so why do we want to put a poison in our body? What's the reason for that?
So I don't know where I heard this, but have you also heard that fluoride, when it's in the water, can leach lead out of the pipes?
Yeah,
okay.
It does.
Okay.
It does.
So lead, of course, being heavy metal, that we definitely test for as well. We know that's passed on for 4 generations. So I'm assuming there's a component of that. Because we know lead, just any heavy metal toxicity, it decreases your cognition, and it might start with brain fog, right? And then it ends up a few years later, whether it's dementia or Alzheimer's. Man, some of these topics can get pretty frustrating, just feeling like we've been lied to.
Yep, we have.
But that's really what we're on a mission to do, is just bring truth to our community and give them an understanding, let them know that they have choices and there's more information. There's usually 2 sides to the story. Your 2 kids are fighting in the living room. There's always 2 sides of the story, right? So I appreciate your knowledge and your expertise that you bring to our community. Is there anything else that you wanted to add on this? I know we'll definitely talk about some more things in the future, but
well, some of the new and fun and interesting things that I'm doing too, that has a lot to do with chiropractic also, is orthopedically growing the face. And so we have a lot of issues in our culture due to not breastfeeding, due to bottle feeding, not getting good nourishment when we're young especially. And we don't get the full facial growth that our DNA allows us to have. And so now we can go back and we can grow the maxilla, the upper jaw, we can grow the mandible, the lower jaw, to help alleviate the narrowness or the crowding of teeth, and of giving the tongue more space in which the tongue can sit properly. And we're seeing a lot of people that are having sleep apnea, and it's due to that they don't have enough space in their jaws for the tongue to sit properly. And so now the growing edge stuff is we can actually grow jaws by stimulating the stem cells in your body in which to do that. And so that's a new and growing aspect of dentistry that I'm really loving.
that is so exciting. And I know you're also a promoter of the craniosacral therapy,
Right.
with the chiropractic, and just
Right.
I mean, we just have so many amazing things that I know we're going to work together for the next couple, well, more than couple years, right?
Right.
But I'm just making a few notes here of future talks and exciting things like that stuff. It's cutting edge medicine right there. It's so exciting. So thank you, Dr. Cobb, for your time today and your expertise. And yeah, check back. We'll have lots more exciting information about regaining your health.
Sounds good. Thank you, Allison.